disease, this is probably one of the conversations that I find really sometimes quite difficult to have with owners. Dogs that have hip disease come in all different shapes and forms. And I'm going to start with the one that probably gives me the most challenges, and that's the very young dog that comes in already suffering with signs of hip dysplasia at maybe as young as 6-7 months of age. And to be honest, if they're coming to me at 6 or 7 months, that probably means the owner's been noticing problems for at least 4 or 5 weeks before that, because they tend to approach their local vets first and tried some various things before they come down to me. So obviously owners are very concerned at this point. They've got a young dog. They weren't expecting their young dog to be showing such obvious signs of joint problems at this early age. They've heard some very scary things often. They've looked on Google and found some even more scary things. And a lot of them come in thinking that the only choice is surgery. And I think the most interesting thing about hip disease is that it really is a bimodal condition. And we call it a bimodal condition because dogs can be really severely clinically affected at a young age and then drop into a period of time where for several years the condition doesn't appear to cause them any clinically relevant problems. Now, it doesn't mean the problem's gone away, but it means the dog's coping with it to a level that surgery really would not be appropriate. So the first decision for me when the dog comes in these early stages is, let's actually try and get this dog on a really good course of medical management, a really good course of rehab, really good at-home management, and let's see if we can keep the dog comfortable up until the age of more like 14 to 16 months of age. If we can get them to that age, then if the dog's still suffering, then that shows the owner and me that we're not going to drop into that period of time where they're asymptomatic for several years. So therefore, we can both be convinced at that point that surgery is the right thing to do, and then we can talk about what those surgical options are. And if it also means if we get them to that 14 to 16 months of age, if they do need surgery again, then they're a much better surgical candidate at that age than if we were to try and do surgery when they're